part 4 of a beginner palpation series. So if you haven't watched 1 through 3, I do encourage you to do that, especially because in this video we're going to be doing exercises the majority of the time with your hands on your own body, and it will be helpful if you've already been introduced to some of the concepts in the earlier video and ideally practice some of those. So starting out though, I'm going to do one little external thing before we move on to palpating our own bodies and feeling some stuff. What I have here is a pillow from my couch, and besides the stuffing that's in it, I've also put in a balloon. Though the balloon I put in here is with water. You don't have to do it that way, but I wanted to give myself some incentive not to put too much pressure on it because I don't want to pop it and get my pillow all wet. And then the other thing that I put inside is a little figurine that essentially looks like this. It's part of a trio: hear no evil, see no evil, speak no evil type of a thing. So this is a little bit harder. It's made with resin in it. Alright, so what I wanted to quickly talk about as far as pressure is you don't want too much pressure on areas that may cause harm to the patient, so you want to learn your endangerment sites. Starting out, quite frequently, less pressure is better if you're not sure. As you gain more confidence palpating areas and your knowledge of anatomy increases, then you can feel more comfortable pushing on things. But just remember that the more pressure you put into it, the less living tissues are going to be able to move, or you get a sense of them. So usually a lot of pressure is going to be reserved more for finding harder objects like bones. Okay, so if I wanted to feel something like this that has something hard as well as something soft, if I know that there's something in there that I don't want to pop and I have to be careful of in an area, it would make sense that I'd want to find that first. So I'm using less pressure. And here I notice the shape of a balloon, and if I push into it a little bit, I can get a sense that it's squishy, so it makes sense this is my balloon and I don't want to put too much pressure on it. Alright, so somewhere around through here, me knowing the anatomy of my pillow, is that little figurine that I want to find, and I know that there's nothing else in here that I need to worry about. Okay? If you try this at home and you use something other than a balloon and a figurine, please don't put anything in the pillow that might hurt yourself, like knives or scissors or anything. Don't do that. Okay. All right. So I know now though that over here is safe and I'm not going to squish a water balloon. So I can use the same pressure, and I go, all right, there's something over here that's a little harder, but I can't quite get a good sense of it. I need a little bit more pressure. If I push in harder, I can get a sense of it, but if you notice, I'm really bending and I can feel that my back is working. So ideally you don't want to strain yourself when you're examining patients, especially if you're going to be seeing a lot of patients repeatedly throughout the day. So me sitting in this chair and this height of the table and the amount of force I have to put in might not be adequate. So feel free to change up your position and do what you need to do. Okay? So for here, I'm bending down a little bit so I can stay in the frame of the video, but ideally you could stand up straight. But I need to bend over a little bit in order to feel this anyways, because when I bend, I have gravity that's helping me push in, versus if I'm standing up and I'm just going like that, now I'm using a lot of muscle work through here to have to push in, and I can't quite get a sense with my proprioceptors. When I lean in like that, I create basically a proprioceptive circuit and through the rest of my body down to the floor and the table, so that I can get a better sense of how does this resin owl accommodate me pushing my force into it. And so my proprioceptors can give me a lot more feedback. Still from this position I can go back and assess this one, but I've lightened it up a little bit. I actually want to straighten myself up so I'm not putting as much force with my body weight and gravity. Alright. So, for the next part, I'd like you to do it along with me while I am doing it, and that way you can participate while learning. So for this, ideally you want your hair to be loose enough that you can move it around a little bit, and if you have earrings, ideally take those out, or any restrictive clothing, try to make it nice and loose. Okay, so what I wanted to start out with first is the head, particularly up top, the cranium. So let me get a little bit more forward for you. Okay, so remember thinking about layers. I have air. So bring your hands up. We have air. And then if you have hair, you have hair. So appreciate that air to hair. Then if you push the hair down a little bit more, you encounter something else. So that first layer is going to be skin. Okay, get a sense of that skin. Just right where the hair meets up with the head. That's skin. Now essentially push a little bit more. You're sinking into the thin subcutaneous soft tissue layers that are on top of the cranium, on top of the bony skull. And then a little bit more pressure and you'll get a sense of that skull underneath. I want you to lighten up your pressure again so that you're just in the hair layer. And I want you to move the hair around a little bit, back and forth, one way or the other, maybe even little circles. Get a sense of moving hair. You have engaged the hair layer and interacting with it. Once you've done that a little bit, push in again to that skin layer. I want you to do the same thing. You're moving the skin around in different directions. It's attached to all those soft tissues deeper to it, so obviously it's going to pull them around. But your contact and focus is just on that skin, that epidermis, dermis layer. So that's what you are trying to engage. Push a little bit more into the soft tissues. And now you're moving the soft tissues around. Feel it just kind of moving all of that soft tissue clay. Sometimes I talk about it like you're feeling clay. And you're moving it around different directions. And then you're still moving it around, but now your focus isn't so much in the clay as you're moving your mind's focus to how can you move that soft tissue clay and glide it and slide it a little bit over the bones and get a sense of the shape of the bone. Right now you should be on the parietal bones. There's one on either side, and it should be relatively smooth, though there are some bony landmarks that you'll have to learn if you haven't already learned, but mostly smooth. Alright, put your arms down, let them get a little blood flow in case they're getting tired. Don't need anybody cramping up. Alright, so now for the next part, I'd like us to move to the ears. Alright, so same thing. Let's start up here in the cartilaginous portion. So I have air and then skin. And then if you push it a little bit more, you can feel there's something deep to the skin. It's flexible and bendy, so there's that cartilage. Okay, you can wiggle it around a little bit, get a feel for it. Alright, pushing in just to that skin layer, and there's a little subcutaneous stuff under the skin, though not much up here on most people. Rub that skin and soft tissues over the cartilage and get a sense of the shape of the cartilage under the skin. Usually when you start up top, it's more smooth and has a smooth edge. And then as you work your way down in here, a lot of people actually have kind of more this scalloped, ridged cartilage going on in there. But outwardly, if you look, it still looks smooth because there's more soft tissue there. Then we progress down even lower, and now we're not in cartilage anymore, we're in just the soft tissues. So appreciate that skin, soft tissues deep to it. If you have piercings, then you're at an advantage because there's going to be a difference in the palpatory feel of the soft tissues of your earlobe. So I can feel where the scar tissue and the channel are for one of my earring holes here. And then a second one up here that I haven't used in years. And it's not quite as hypertrophic, it's not quite as big of a scar tissue type of feel as the one down here that I use pretty much daily. Alright, Now you can do one side or both, and I'd like you to find your cheekbones and walk down those cheekbones to right about here. So these bones here are called the zygoma. We're going to do the same thing. Center yourself, feel the floor or your feet under you. You can do this standing, you can do it sitting. You can do it lying down. Air, skin, subcutaneous, and then there's something harder. There's bone. You don't need to press on it too hard. Just get a sense that it's there. Okay? Alright, so I'm going to sink into the subcutaneous layer, and I'm going to move it around, trying to get a feel for the shape of the bone. Is it smooth? Where's its top part? Probably want to be a little bit more like right there than here. Can I feel its bottom part? So right there is the inferior edge of it. Okay, so you go down a little bit more, pushing in again. Might feel a little bit more muscular now. There's more soft tissues here. I've got masseter and some other facial muscles. Okay. Can you push those up against something? Sure enough, yes, there's more bones in there. These are going to be the maxillas. Get a sense of the shape of the maxilla. You can follow that this way. Can you feel how this has a little bit more of some ridge to it in some areas? There's these little ridges like that. If you head down even lower, move those soft tissues around. Now the ridges are even more pronounced, and you can feel the segmented parts, and those are your teeth. It's a lot easier if you know what you're feeling for. You have some familiarity with the teeth and the anatomy. So your mind-eye can go ridges right here, deep to my cheek. Oh, it makes sense that it's teeth. So anatomy informs your palpation skills. All right, we're going to skip the neck. Now we are going to start to feel some more obvious living physiology. So you can hold up one hand, but if you have low blood pressure, you might not be able to feel the pulse with it up like this, so maybe you will have to have it down. But if you can, and either way you have it positioned, find your thumb and follow it down, past the wrist just a little bit. Don't use your thumb, because your thumb has a nice pulse, so use some other fingers. And very gently, skin. Just find that skin layer. If you can already feel the pulse, then you might have high blood pressure, or you might be pushing a little past skin. So ideally, try to just feel the skin and not the pulse. If you want to see where I'm at, I'm right there. It's going to be your radial artery. And then barely try to feel past skin. And what you should feel is that pulse pushing against you. You're not pushing on the pulse. It's hard to feel what a fluid is doing if you're squeezing it. You are pushing the skin and the subcutaneous tissues to meet that artery, and then the pulse should push against you. If you don't feel it right away, right now, feel free to come back to this or any of the other exercises later, or listen to it a few more times and practice them. All right, now we're going to move to our upper rib cage. Okay, so for this one I have another layer, not very thick. So air, shirt, skin, squishy subcutaneous tissues, and then there's something underneath. You can push your whole hands in, okay? So remember, the mechanoreceptor tactile sensation is better on these 3 fingertips, but we're using proprioceptors, so we can use our whole hands to feel. Now when you're starting out, sometimes it can be confusing to make sense of sensory information coming in from this being your contact. So you can break it down. Fingertips right here. Once you go cloth, skin, subcutaneous tissues, and in. This is a bone here, the sternum, so might feel a little bit more like some of the bones you're feeling up higher. If you head out this way, this is cartilage. So this should feel a little bit more squishy. It's not as flexible as our ears because this cartilage is thinner and this is thicker to match and meet up with our bony ribs, but it should still have a little bit more give and squish than the bone here, the sternum. All right, so now nice deep breaths in and out, and I want you to just kind of feel how your rib cage expands with your breathing. If I turn to the side, and what I want you to notice is do the left and right sides move evenly as you breathe in and out? Do they feel like they're filling your hands the same way? The same amount, moving your hands the same distance? Are they pushing up into your hands the equal parts of your hands, pushing against the middle of your hands and all your fingertips the same on the right and the left? Or is it different one side versus the other? Osteopathic somatic dysfunction wise, we tend to look for somatic dysfunction in an area that does not move well. So if both sides move really well, then that's great. You kind of screened that area and didn't find anything on their active range of motion with breathing that made you really think one side versus the other had an issue. But if one side doesn't fill up or relax as much as the other, whatever side doesn't move very well, that's where you'd want to look for somatic dysfunction. And those are things that you will hopefully be learning in labs or workshops if you haven't already. Okay. So the last exercise, if you haven't already laid down, please do. I'm going to take my hair thing out. All right. So if you weren't already laying down, make sure you get a sense of some breath laying down this upper rib cage. You might even notice that the rib cage motion changed when you were standing versus sitting versus laying down. That can give you clues, palpation-wise, when you're examining a patient, because they might have a postural issue, a leg length shorter or something going on that when they're standing upright and gravity is having to hold their body, that it pulls on an area a certain way. So maybe you might notice a difference in one position versus the other. Alright, so once you get a sense of that rib cage in the laying position, put your hands on your abdomen. So make sure you're below your rib cage. Move the soft tissues around to get a sense where that is. Here I am in my abdomen. Okay. So now, as you breathe in and that air fills up your lungs, and it's moving the rib cage up above, the way that that air gets pulled in is the thoracoabdominal diaphragm muscle. Big muscle attaching all to the bottom of your rib cage. And when you breathe in, that contracts and it pushes against your abdominal contents, so all your intestines and everything. And you should feel, when you're breathing in, that your abdominal content, your abdomen, pushes up into your hands. So it pushes anteriorly when we speak about the body. But since I'm lying down like this, it's up away from the earth. And my hands are the side, and you can get a sense of how the abdomen should move. Now, admittedly, I'm talking about how it should move in an ideal somatic dysfunction-free way, but you are an individual, and you may have some somatic dysfunction, and so you may notice that it moves a little different than maybe what I'm talking about. But ideally, left and right should have a similar type of a feel. Right sometimes doesn't move quite as well as left because of that big liver stuck on the diaphragm. And ideally, when my hands are on left and right side, I should feel them being pushed up and out. So they're being pushed anterior and lateral. If I switch my hands, so instead I have one above and below, still on the abdominal wall, nice deep breath in. I should still feel the abdomen pushing my hands anteriorly. But now I should feel them pushing my upper hand a little bit cephalad or superior towards my head. And my bottom hand, besides being pushed forward, should be kind of tilting downwards or caudad inferiorly towards my pelvis or feet. So you want to get a sense of that. So that helps you feel some physiologic motions of breathing and the pulse. And in the next video, I will talk a little bit more about how you can feel for some joint motion in yourself. It's definitely helpful to be able to assess that on another individual. Even the things I talked about today, eventually you're going to put your hands on people and assess that. And just because you felt it on one person doesn't mean that you have it down pat. You have to feel multiple people and do the same thing essentially over and over on different people before you can really get a sense of what's normal. And then that helps you better identify abnormal. Keep practicing.